almost to the point I have to get my wife to.
Yeah. Well, my wife just buzzed it for a few weeks now, so I might never go back to a barber. We'll see what happens.
I feel like I got like 1970s sideburns maybe so long.
Well, from Cambridge have two prices, the local resident price, and Thursday or Friday, and the price for people coming from out of town.
That is not what public health wants to hear.
That's what they're.
Oh, the people coming from out of town, are they paying more or less? Because I think more would be the term.
Well, they're paying more. So haircuts are going for $50 and $70 now. So where it was normally 25.
Great price.
Yeah, you get a haircut, cut your hair something.
No, I use that, without the sheet, the back, and then the white cut back.
Okay, good, Lawrence, we don't need to charge me.
Yeah, we'll get
Brampton, I get you for you? Yep.
Yeah. No, I tried to pull them out. Just tried to reach it. Try to grab it.
Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly update on the COVID-19 efforts underway in our city. Today I'm joined by Regional Councillor Pat Fertini, who will give a bylaw enforcement update, City Councillor Doug Willans, who's going to talk about the success of our backyard garden program, Dr. Lawrence Lowe, the Peel's Public Health Intermedical Officer Health, who will talk about our most recent case counts and the work of Peel Public Health. And also today, it's an honor to be joined by Dr. Naveed Mohammed, who is the Chief Executive Officer and President of the William Osler Health System that is doing great work on the front lines of this battle with COVID-19. Two things I wanted to mention at the start of this update is I wanted to thank the provincial government for their temporary ban on commercial evictions. This is something we had proposed on May 12th in consultation with our small businesses. We've been hearing pretty loudly that small businesses were concerned that there was going to be evictions that would throw small businesses into havoc. Ma and pa shops that had poured their energy, their heart, their soul into these businesses, and there needs to be some understanding during this pandemic, and I'm grateful for the provincial leadership on that front. And it's also a good opportunity to underline that landlords should apply for the Canada Emergency Commercial Rent Assistance Program. With these two programs, with the temporary ban on commercial evictions and the rent assistance program, I really hope that's going to keep small businesses afloat during this pandemic. The second thing I wanted to underline before we start on the update is last week I mentioned that we were making masks mandatory on Brampton Transit. I want to also highlight that in the weeks leading up to the mandatory date of July 2nd, we will be doing a promotional campaign in which we will be giving away 100,000 masks to Brampton Transit riders at the terminals to help create awareness for why wearing masks is so important. And then starting on July 2nd, it will be the responsibility of the transit riders to bring their own mask or covering. I'd also like to note today that there's been much talk about the reopening and the fact that it is now regional. And I just want to underline this is something that was very important to the GTHA mayors. I'm on a weekly call with the mayors and the GTHA that Mayor Tory hosts, and we felt very strongly that the reopening needed to be regional. There are parts of Ontario that are ready for reopening, but certainly in the GTA, we're still in the thick of it with this COVID-19 pandemic. And the fact the provincial government has recognized that is heartening, because we continue to believe it shouldn't be politicians deciding on when there's reopening dates. It should be driven by the best advice of public health, the best advice of our local health experts. And what we're hearing from them is that we still have work to do. I urge residents to also do what is in the best interest of your community and really listen to this advice. The physical distancing is so critical, and it's the only way we can move forward. Now, we do have some positive news that I can share this week. Brampton has been one of the last communities to reopen parks. We've taken a very cautious approach, and while most parks are now open in the GTA, we hesitated because of the higher caseload of the virus in our community. But as of this Thursday, June 11th, all Brampton parks will reopen to the public. And this is on the advice of public health, understanding the mental health benefit that being out in the fresh air during good weather brings. This will include open shade, picnic shelters, benches, leash-free dog parks, the White Spruce Park disc golf course, and skate parks. I would note this does not include playground and play structure, sports fields, amenities, outdoor fitness equipment, outdoor swimming pools, splash pads, wading pools, washrooms, or drinking water systems. They still remain closed within the parks. As an additional measure, we are actually wrapping plastic fencing around the playground equipment to discourage public use. I'd also note that with community health and safety top of mind, strict physical distancing is going to be required. I just want to stress this. We're opening all the parks, and Brampton's got 500 beautiful parks, but we're going to be very strict on the enforcement of physical distancing. Signage will be posted at shade and picnic shelters indicating maximum capacity. We're also going to launch a Parks Ambassador program. Educating residents on the importance of physical distancing is so critical, and our Parks Ambassador program will help with that education. Beginning on June 13th, we will be launching a Parks Ambassador program, which means on weeknights and weekends, city staff will be in the high-traffic parks, engaging with and advising residents about health and safety measures in place. And I think this Parks Ambassador program speaks to the collaborative partnership we're trying to have with residents to make sure we follow the advice of public health in a positive manner. I also want to note that today we have the Gore Meadows Pop-Up Assessment Center. And I want to thank the provincial government and public health for working with the city of Brampton. These pop-up mobile testing centers are great. Testing makes such a big difference. I went in for testing myself a week and a half ago, and it is easy. There should be no apprehension about going to get tested. I tested negative, and you'll find that assurance, if you're out in the public, knowing that you've tested negative will give that confidence to your family and your coworkers that you're not a risk. And so if you're in the Gore Meadows area, please get tested today. I'll be visiting this pop-up center later today with our health minister, Christine Elliott. It's at the Gore Road in Brampton. We know this is a critical time for testing to help us flatten the curve. So please, Brampton residents, if you're watching, go today and get tested or make plans to be tested. And we're going to hear later today from Dr. Naveed Mohammed about the new drive-through testing facility that will be at South Fletcher's. These are great opportunities to get tested, and it shows how there is now going to be wide availability and capacity to get tested. The last update I wanted to give today before we hear from our health experts is on marriage licenses. I've heard so many different cases, compassionate cases of people that are depending on their marriage license. And I want you to know that starting on June 15th, we will be accommodating that in the city of Brampton through an online mechanism. You can email marriage.license@brampton.ca to submit your request. Civil ceremonies will still remain closed, but we will be issuing marriage license to help those that want to make sure their love is official. On that note, first up is Dr. Lowe, our Medical Officer of Health, to give you his update.
Thank you, Mayor Brown, and good morning. As of this morning, Brampton has seen a total of 2,739 cases of COVID-19. 2,159 of those cases have recovered, 499 are still active, and 81 Bramptonians have sadly passed away. The data are clear that COVID-19 has started to decline from the new plateau in our 7-day moving average, around 40 to 50 new cases a day. However, since early June, it is also clear that most of our new cases in the region of Peel have been found in the city of Brampton. Early this week, the province announced Phase 2 plans to reopen Ontario. We understand and welcome that Phase 2 will follow largely a regional approach, with Peel and Brampton mostly moving ahead at a later date yet to be determined. This gives us time to reopen in a safe and cautious manner and to get ready. And as we prepare, it is prudent for me to review the goals of our ongoing pandemic response. They are, to the greatest extent possible, to prevent sickness and save lives, to protect our healthcare system, and to minimize the societal and economic impacts of COVID-19 on our community. We certainly mourn with those that have lost loved ones to this disease. We also know, however, that the first two goals have largely been grasped. Many lives have been saved that might otherwise may have been lost, and our healthcare providers and first responders have been spared the trauma seen in other jurisdictions. This was encompassed in one concept: flattening the curve, dropping the top of the curve and lengthening the timeline, spreading out the infections to prevent our system from becoming overwhelmed. Having largely accomplished this, we must now turn our minds to the third goal, which is minimizing ongoing economic and social impacts. On this, we know that new cases represent ongoing transmission and risk. It is this ongoing transmission and risk that has held Brampton and Peel back in the phase 2 reopening in this instance. However, we know that the closures were never intended to be permanent. They were a collective sacrifice that brought COVID-19 under control in our community, and we must now seal the deal. We must now prepare for phase 2 and practice the 4 core behaviors that we've all learned about in the past months that are all part of our new normal. Stay 2 meters away while in public. Wash your hands frequently and avoid touching your face. Wear a non-medical mask where distancing is difficult. And if you feel sick, get tested and stay home. I call on each and every Bramptonian to follow these core 4 behaviors every single day, and call on our local business owners and community leaders to prepare your operations and premises to help foster these behaviors. Let me also be clear that we can test and trace as much as we want, and the capacity is there when things fall through and transmission does occur. Indeed, as Mayor Brown has pointed out, we are launching a mobile pop-up testing site in Northeast Brampton today. But testing and tracing does not stop transmission in the first instance. That will take each and every one of us practicing the core 4 behaviors, doing our part to bring cases down and keep cases down and allow us to quickly return to a new normal. So let's do this, Brampton. Let's take this seriously and let's get this done. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe, for your continued hard work with Peel Public Health. Next up, we're going to be hearing from Dr. Naveed Mohammed, a longtime physician in our health region who's taken over as the head of the Osler Health System and is working 24 hours a day to keep our community safe on the front lines. Dr. Mohammed's going to give us an update on the new assessment center that I think is going to make a real difference in testing, and it's a great example of how the city of Brampton and the hospital can work together.
Thank you, Mayor Brown, and good morning. I'm pleased to be here today and grateful for the partnership of Mayor Brown, Brampton City Council, the City of Brampton, and Peel Public Health during these last few months. Osler is extremely grateful for the support of the community during this time. Our staff and physicians are emboldened by the support that you've given us. I'm here today to talk about our COVID-19 assessment and testing, something that we know that this community continues to rely on. Osler was one of the first hospitals to open an assessment center at our Peel Memorial Center site for integrated health and wellness. We've also opened a drive-through assessment center at our Etobicoke General site, or just very close to it. Both of these centers have been very, very busy with testing. In total, we've performed over 44,000 COVID-19 swabs and tests. Given the popularity of the Etobicoke site as a drive-through site, we have now seen the benefit of the outdoor drive-through model. It's a model where patients feel safer. They don't have to come out of their cars. It's private, it's confidential, and it's also safer for the staff that are performing the tests. We've practiced and perfected the model in that we're able to move more than 700 to 800 people through the Etobicoke drive-through model per day. We are testing 300 patients a day at Peel Memorial, and to increase the opportunity for our Brampton residents to have a test quickly and in a private manner, we will be launching a drive-through assessment center at the South Fletcher Sportsplex. And that is located near McLaughlin Street, near the Sheridan College campus. This will open next week on June 15th. On first day, we will have a soft launch at 10 a.m., and then we will be open from 8 a.m. to 8 p.m. We feel strongly that this move, coupled with the pop-up testing efforts undertaken by Peel Public Health, will provide important expanded capacity for testing for Brampton and the surrounding community. Increased testing, as Dr. Lawrence Lowe said, is critically important as Brampton and Peel region continue to be challenged by higher numbers of COVID-19. Osler is very pleased to be part of the collective solution as the economy reopens and we look at COVID-19 related restrictions being lifted further in the community. We look forward to continuing our work with the City of Brampton and supporting Peel Public Health as we fight the spread of COVID-19. Thank you for the opportunity to speak today. Mayor Brown?
Thank you very much, Dr. Mohammed. Next up, we have Councillor Pat Fertini, who will be giving a bylaw enforcement update.
Good morning, everyone, and thank you, Mayor Brown. So today I'm here to provide the enforcement bylaw for the week from June 2nd to June 8th. There was 127 charges laid and 80 warnings between June 2nd and June 8th under the Emergency Management Civil Protection Act. I'd like to point out that these were the most charges laid since the state of emergency has been declared. One charge was non-essential for a hair salon. 18 charges were laid also at 5 separate park investigations using park equipment, playing cricket, playing soccer, and volleyball. A reminder to residents, as park begins to open, it is essential to know that the use of park equipment will now be permitted. In addition, there were 4 separate incidents in parking lots gathering with a result of 16 charges. A majority of the complaints were received this week from residents from social gathering. In the past week, we had 263 complaints received from social distancing, which went up from last week's complaints at 179. There was 92 charges laid in 24 house parties. One house party disrespected bylaw, which resulted to 19 people being charged at the party. With the rest of Ontario starting to reopen on Friday, we still have to help the impact of our health system and help reduce the spread of the virus. We encourage everyone to have patience on the process of the reopening. If you break the bylaw, you will be fined. If you are unable and unsure and would like to know the rules on what's open, what's not, what you're allowed to do, and when you're not allowed to do, please call 311, and they'll give you all the information you need. Together, let's do our part, protecting the health and safety of our community and strengthen our economy. Today, I will be presenting a motion at council to allow restaurants and bars and other businesses to have outdoor patios, and always protecting the customers and also the employees. We want to ensure all businesses and services are permitted to reopen in a proper and safety measures in place with the guidelines from the provincial and health and also the city. Let's do our part, let's stay safe, and please follow the bylaws. Thank you.
Thank you, Councillor Fertini, for your efforts on bylaw enforcement and expanded patios in Brampton. Our last update is going to be from Councillor Doug Willens, who has poured his heart into making sure Brampton has the most incredible backyard garden program that we've ever seen in our city. It's great for the environment, it's great for food security, and Councillor Willens will speak to the success of our backyard garden program.
Thank you, Mayor Brown. Yes, hello everyone. I'm excited to be here to give an update on our backyard program that has exceeded all expectations and incredibly well received by our Brampton residents. The backyard program, as Mayor Brown said, was initiated on a way to help food security in our city. Since the launch of the program in April, we have received an overwhelming amount of requests. To date, more than 5,000 soil deliveries have been made, and more than 4,000 homes have received seeds. Although the program now is officially closed, our amazing park staffs are rolling out the final deliveries of soil and seeds this week. I want to take this opportunity to thank everyone involved, especially our park staff, our volunteers, and of course our residents who stepped up to the plate. I also want to thank 5 corporations who helped ensure the success of this program: Scott's Canada, Mattamy Homes, Fieldgate Developments, Paradise Homes, and Tack Holborn Corporation. I'd also like to thank some local sponsors, Lakeside Garden Gallery, Mocon Greenhouses, and Rich Fertilizers for their contribution to the program as well. Over the next couple months, we'll be sharing more gardening tips on social media, so stay tuned. We also want to see the garden photos, so please send them in and tag us at City Brampton. We love to see them all. We'll encourage those that can to support some of their homegrown produce to those in need or to some of the following food banks: Regeneration Outreach, Knight's Table, United Sikhs, and Khalsa Aid. If you're not able to drop the produce off, please call us. We will arrange someone to pick it up. And as always, stay safe, stay healthy, and happy gardening.
Thank you, Councillor Willens, and now we're happy to take questions on our weekly COVID-19 report from the City of Brampton. Our first question is from Graham Frisk at the Brampton Guardian.
Hey, Mr. Mayor, how's it going? Just a couple of questions here. In light of the protest in the city on the weekend and possibly more to come, if the city is going to allow sort of large gatherings for protests, is the city still justified in issuing large fines and for other types of gatherings like backyards, parties, or parking lot parties that also exceed physical distancing limits?
Well, my understanding is that the protests that occurred in Brampton, the people responsible, they were keeping physical distance and wearing masks. And certainly we have an appreciation and respect for this moment in our history that we need to listen and learn. And it's why we've been supportive of this protest. I understand there's another one on June 13th and 17th. I'm not sure if Dr. Lowe would like to add additional comment to that.
Thank you, Mayor Brown, and thank you, Graham, for the question. This really speaks to what I highlighted in my opening remarks. I think to the extent that individuals can stick to the core 4 behaviors that have been talked about in the last little while: physical distancing, wearing a non-medical mask when that's not possible, washing one's hands frequently, and making sure that you're staying home and getting tested if you are feeling sick. I think those are the behaviors that will help us regardless of what happens or what reopens in the days and weeks to come, and certainly in recognizing as well the importance of these protests and the fact that racial inequities and disparities are also a significant risk to the health of individuals in our community. Thank you.
Thank you. Yeah. Yes, Graham?
One follow-up here for Mayor Brown. As a member of the Police Services Board, I'm just wondering what your position is on the sort of defund the police reform campaign as it relates to Peel Region Police.
I believe Peel Police is a little bit ahead of the curve. One of the reasons we picked our new Chief of Police, Nishan Dirapa, was he spoke a lot about grassroots community engagement. And so much of this campaign is focused on investments in mental health, and that's what we're doing right now with the Peel Police. If you recall, just a few months ago, we launched some new mental health campaigns of how to collaborate mental health and policing together on responses. And so there'll be an update, I'm sure, in the near future from Chief Nish. But what you're going to hear is that much of the essence of what this movement is about is we are already embarking upon in Peel Region. And I believe that's the right approach. You can't criminalize mental health, and that if you want to defeat crime in a community, you have to attack it at its roots. Next question is Caitlin Lee from 680 News.
Yes, good morning. The province announced yesterday that child care centers could open province-wide as part of Stage 2, and now a report from the Canadian Press says that medical officers of health can decide if regions are not ready for that. And considering, Brampton has been left out of the rest of Stage 2, and you were talking about the high numbers, are you considering pressing pause on this in Brampton, and are any child care centers in Brampton actually ready to open on Friday?
Well, we'll take our advice from our medical officer of health, and so maybe it's best to have him answer that question if he believes we'll be ready.
Thank you, Mayor Brown. Thank you, Caitlin, for the question. Indeed, we're actually looking very closely at the announcement around the reopening of childcare centres. We do recognize and have learned many lessons from the ongoing operation of emergency childcare centres in our region throughout the course of this pandemic, and we'll take our cues and make our recommendations on the basis of what we've seen there.
Okay.
Yeah, and I was just wondering, the province has also said they'll be reviewing the trends in numbers each week to see if regions left out can move on to Stage 2. Are you optimistic about Brampton rolling out the rest of Stage 2 soon? Do you even have a timeline on that?
Thanks, Caitlin, for the other question. I think the important thing that we're going to be looking at is taking the time that has been given in the pause of Phase 2 to make sure that our businesses and the venues and facilities that are meant to reopen at that time are able to facilitate the core 4 behaviors that I've described throughout this press conference, and also to make sure that residents are also ready and prepared to essentially emerge into a new normal. So we will continue our conversations with the province and continue to monitor our indicators to identify areas that need attention as we move towards a Phase 2 reopening. Thank you.
Okay, our next question is Sumit Dami from Omni News.
Hi, Mayor Brown. Thanks for taking my question. Regarding body cameras, a lot of studies from the U.S. suggest that body cameras may not be as effective as we think. And a lot of community groups are worried that funneling money into the cameras, it could be better used for mental health initiatives. So I'm just wondering if we're expediting the process on the 26th for that, do you think that's a good idea? Kind of what's your reaction?
I don't think you have to choose between wanting more transparency in policing and wanting to invest in mental health. I believe you can do both. I want to have a police system in Peel that is a model for others to follow, and it's why we're pursuing both quite aggressively. The mental health investments and looking at body-worn cameras. I believe transparency creates accountability. I believe transparency protects good police officers, and it exposes bad ones. And so it's why Mayor Crombie and myself have advocated for the body-worn cameras, and we're grateful that our entire Police Services Board has supported this.
Thank you. My follow-up would be for Dr. Lowe. I'm just wondering if there's an update on the collection of race-based data in Peel and when this will be available for the public.
Yes, thank you very much. My team has actually conducted the initial preliminary analysis, and we are validating the data at this point in time from the sample and the data that were collected, with an intent to release it in the days to weeks to come. Thank you.
Okay, next up we have Nida from The Pointer. Nida?
Hi, good morning. Can you hear me?
We can.
All right, my first question is for Dr. Mohammed.
Okay.
Good morning. Has Osler done anything or implemented any new measures to ensure that the testing reporting error that occurred last week doesn't happen again?
We usually forward those questions to Ontario Health, since Ontario Health is running the testing and reporting issue. But I can assure you that Osler has worked with its lab partners and Ontario Health and Public Health to make sure that moving forward, each public health unit is informed of any results in a timely manner.
Okay, thank you. And my follow-up is for Dr. Lowe.
Morning, Nida.
So the first pop-up center in Brampton is opening up today at Gore Meadows Community Center. Has there been any investigation into what makes this particular community or even other parts of Brampton prone to the spread of the virus?
Yeah, thank you very much for the question, Nida. This was identified on the basis of our review of household clusters and also the broader geographic map that you've identified, which indicate that there are a larger proportion of individuals who have tested positive for COVID-19 who reside in that part of Brampton. Again, it's important to remember that it's not speaking to the risk of transmission. We know that transmission can occur anywhere in our family, in our community rather, but this is identifying, at least in that segment of Brampton, a more convenient opportunity for people who may be linked to those household clusters and in that broader community to come out and get tested. And certainly if there are people who are meeting the criteria for testing, we encourage them all to come out today from 10 to 6 at the Gore Meadows Community Center. Thank you very much.
Okay, next up we have Nitin Chopra from Prime Asia TV.
Thank you, Mayor Brown, for taking my question. I have two questions, one for Mayor Brown and one for Paul Morrison. My first question is for Mayor Brown. As we know that Councillor Sharmin, she recommended 50,000 free masks for the transit drivers. My question is as Alberta province, they distributing the masks through Tim Hortons, McDonald's and A&W. Can City of Brampton do the same thing and take a lead in this? Instead of only transit drivers, we can give masks to whole of the Brampton community?
So it's not just transit drivers. Initially in the pandemic, we provided masks to our transit operators. What this campaign is not 50,000 like the councillor recommended. It's actually 100,000 that we're doing. 100,000 masks as a promotional campaign for what will become mandatory on July 2nd. So Brampton has been the second transit department in the entire country to make it mandatory. I think only Ottawa was before Brampton, so we've been real leaders on trying to make masks mandatory in areas where there's a greater chance of exposure. And maybe Dr. Lowe could speak to this as well. Or use of masks.
Thank you very much for the question. Certainly, we know that masks are one important part of an intervention that is going to keep people safe. It really comes down to the 4 core behaviors: physical distancing, masks where you can. And so certainly in indoor spaces, in public transport, where distancing is difficult, the recommendation is to wear a non-medical mask and to ensure that you're wearing it properly. So make sure that you're washing your hands before you put it on and washing your hands after. And then before you take it off, making sure that you're washing your hands and removing it and then washing your hands after, and also ensuring that at every time when the mask is on, that it is covering your nose and your mouth and that you're not touching or fiddling with it or moving it up and down. So certainly masks are one part of our strategy that is going to help us put COVID-19 behind us. Thank you, and back to the Mayor.
Okay,
I have a follow-up question for Paul Morrison. My question is, recently City Council, they passed for the bulletproof jacket and body cameras for bylaw. So does the bylaw officers, they need the bulletproof jacket? Any incidents in the past which recommend this? Because body cameras are necessary, we know. But is bulletproof jacket also an essential for bylaw officers?
I can tell you we did a thorough review back in 2019, and at that time we deemed that they're not necessary for our bylaw officers. We promised to revisit that in 2021 and take another look at it. And between the time, we haven't had any serious incidents where we feel that body armor is required.
Okay, thank you, Nitin, for your questions. Next up, we have Mitul from Y Media. Mitul?
Good morning, Mayor Brown.
Morning.
So, systemic racism within the Peel District School Board has come to light, and what actions would you and can you take to rectify things?
The report was alarming, and I'm grateful that the Minister of Education, Stephen Lecce, initiated a review of the Peel School Board and how they're handling systemic racism. There was much that came out of that report that left a very unsavory feeling about how this is being managed. They have to do better. They're being given a period for a response of how they're going to remedy this situation, and I hope they do so quickly. I frankly have not been pleased with how they have handled some of these challenges, and there's been more than a number of incidents, and we will be watching their response closely.
So my follow-up question is regarding the body cameras for police officers. Do you believe Peel Police has the financial resources to make this addition?
I believe it's our responsibility to ensure transparency, and we believe that we can find the funding internally to make this possible. The fact that we have all members of the board supportive and the chief supportive is a good sign that this will be acted upon. Thank you, Matul. Our next question is Lucy from in Brampton.
Good morning.
Morning.
So my question is in regard to the reopening of parks in the city of Brampton. Are there specific concerns ahead of the weekend, considering that the city of Brampton issued the highest number of physical distancing fines this past week?
So, Lucy, I said at the start of this pandemic that we were going to listen to the advice of public health, of our health experts, and it shouldn't be politicians making decisions that really should be evidence-based, science-based. And so when Dr. Lowe told me he felt that the chance of transmission was low in outdoor spaces, that if we took appropriate precautions, that this was his recommendation that we could open parks, we trusted that recommendation. He spoke to us about the mental health benefits of having parks open, and I have confidence in his decision-making based on his years of training that this was in the best interest of the health of our residents. And obviously, if numbers somehow spike because of this, we would revisit the decision, but we trust his recommendation.
Thank you very much.
Tabish from Red FM Radio. Tabish, are you still there?
Yeah, can you hear me, Mr. Mayor?
We
Good
can.
morning.
We can.
So Dr. Lowe said that from the beginning of month of June, there are so many new cases in Peel, and a lot of them are in Brampton. But the city of Brampton is resuming some 32 bus routes starting next week, and the wearing of masks are being mandatory from July 2nd. So why this resuming of service could not be delayed till July 2, or the masks be made mandatory a bit early than July 2?
Well, our transit commissioner is here. I'll have him answer that specific question about the resumption of routes. But I would say transit has never been something that's been canceled. The reason that transit's been deemed essential work is our country depends on it. You look at Brampton, we're the food processing capital of Canada. We help fill the grocery stores of the country. Food security is critical for any nation, and Brampton contributes to that. Those companies told us that transit was critical. They would not be able to function properly if they did not have public transit. At the same time, we've got major laboratories like Dynacare in Brampton that is critical to the provincial laboratory network. These are not things that we could do without public transit. So we are taking the appropriate precautions. We brought in free fares, rear boarding, making masks mandatory now. We have been very aggressive on protecting the safety of our operators and our riders. But I think it's fair to say it would not be in Canada's interest to disband public transit, given how reliant essential workplaces are on it. And if our transit commissioner would like to speak to the new routes that are being resumed.
Yep, thank you.
Yes, thank you, Mayor Brown. And as the mayor has mentioned, June 15th, because of the demands in our community and as businesses open up, we're getting stronger and stronger demands for ridership. And given our limited capacity in terms of trying to respect the physical distancing, we are introducing a lot more routes that have been canceled before, effective June 15th. And as the mayor has mentioned, July 2nd, as we move towards mandatory masks, a part of that is we're returning to front door boardings as well as fare collection. And that's all part of the recovery plan as we start introducing more services within the city. Thank you.
Thank you.
Next up, we have Rajinder Sani from the Parvasi Media Group. Rajinder, are you still with us?
Yeah, good morning, Mayor.
Morning.
We are getting reports today that instead of only older populations, we are having now younger people also infected. And in many areas, there are even 40% of the total number of cases. So in last few years, Brampton has a large surge in the younger population, particularly with the settlement of thousands of international students who are looking least serious about following these instructions as per the data available now. So what city is thinking about to deal with this?
So I'm going to have Dr. Lowe speak to this. We do have the youngest population of a big city in Canada. I have noticed that the number of new positive COVID-19 cases tend to be disproportionately amongst our youth, although the severity is not matched in terms of the severity we've seen with other populations. It's still a significant risk to the city. It allows transmission to continue. It allows this to continue to circulate in the communities. So, of course, we're alarmed by it, and it's why we're being so strict with bylaw enforcement. It's why some of the amenities we've delayed opening because out of concern that it would continue to spread. But if Dr. Lowe wants to speak to the challenge we have with youth transmission, I think that would be the appropriate response.
Thank you, Mayor Brown, and thank you, Rajinder, for the question. It is really clear that in moving back to the community, we are now starting to see more positive results of COVID-19 for Bramptonians who are aged between the ages of 20 to 59, which is the working age population, and certainly youths as well under the age of 20. And I think it really speaks to a number of things. First of all, reopened workplaces, reopened businesses, and particularly as we move towards a phase 2 reopening, it is absolutely crucial that business owners, that places of worship that are opening on Friday, anything that is reopening in our community, community leaders and proprietors need to step up and need to take measures and put measures in place that allow people to practice the 4 core behaviors of distancing, masking, hand hygiene, and staying home if they're sick. And similarly, in addition to the workplace piece, we know that many young people have also chosen to disregard or to ignore the ongoing distancing pieces. And I want to say, very clearly, while we are fortunate that young people do not have the same severe outcomes that vulnerable groups such as older people or people with medical complications seem to have, on occasion, young people do have severe outcomes and require hospitalization. And on occasion, we do know that they do transmit that onto more vulnerable populations, grandma, grandpa, etc. And I think it is highly important to remember that the reason why Peel is not moving forward in phase 2 with the rest of the province is that we are still seeing transmission and we are still seeing positive cases in our community. And if we want to get out of this, if we want to get to the next step with phase 2, we need to stick to the 4 core behaviors and make sure that we are doing our part to move on. Thank you very much. I'll pass it back to Mayor Brown.
Thank you very much. My next question is for Dr. Naveed Mohammed.
Okay.
Yeah, Dr. Mohammed, good morning.
Good morning. How are you?
I'm fine, Dr. Mohammed. Dr. Mohammed, my question is that the Brampton Civic Hospital was already running above its maximum capacity, we know that. But now we are being told that Brampton is going to be the hotspot as far as our province is concerned. How well equipped we are to deal with the situation? And my next question, a supplementary question to you is that we are demanding for the second hospital more number of beds as quickly as possible. So given these circumstances, the scenario, what do you think? And how you are getting help from the provincial, federal, or other parts of the governments?
Thank you for the question. So I'll answer the first part. As part of our COVID preparations, we expanded our bed capacity at all of our sites, and that includes Etobicoke General and Brampton Civic. Usually, we have been running in the past at 100% or more than 100% occupancy, and this is why we had the hallway medicine issues. During COVID, because the province has allowed us to open more beds in other conventional spaces, we've only been running at 90% capacity or occupancy. In fact, yesterday our number was close to 85%. So we are well prepared to handle any surge that may come our way in terms of any COVID patients or other patients. And I want to make clear that I know that we have a large number of cases in this region, and at one point there was the word hotspot mentioned, but I can tell you that in collaborating with Peel Public Health, with Toronto Public Health, we're managing our cases really, really well. In terms of more redevelopment at Osler, whether it's building a new hospital or Peel Phase 2 and expanding our capacity of beds at Peel, or expanding our capacity at Brampton Civic and at Etobicoke General, the province continues to work very closely with us. In fact, they have asked us to submit any acute needs that we may have, which means urgent needs for the fall when influenza will come back and COVID may rise again. So I can tell you that we're working actively with the province to ensure that we continue to increase capacity to serve the Peel and Brampton community. So as good news comes our way, I'll be happy to share it with you on an urgent basis. Thank you.
Thank you, Dr. Mohammed. And our last question, they've actually left. Okay, well, thank you so much, everyone, for attending to our COVID-19 weekly update from Brampton City Hall. And thank you, Dr. Lowe, Dr. Mohammed, Councillor Fertini, and Councillor Willens for participating in this week's update, along with Paul Morrison and our Transit Commissioner, Alex Maholovic.